Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Now, in the blowout fracture, how are you going to treat the blowout fracture of orbit? The blowout fracture of orbit can actually be treated by conservatively. Mainly, we can do it by the conservative management. In the conservative management, we can give the patient antibiotics can be given to the patient and anti-inflammatory drugs can also be given to the patient, and surgery can be given to the patient for the blowout fracture. In the surgery, if there is no improvement in anophthalmos or if there is any diplopia in the patient, then we do surgery. Surgery is done only if there is no improvement of anophthalmos by medical management, or if there is diplopia, then we do surgical management in blowout fracture.
thank you and thank you for watching.